I've never been perfect at quoting the exact study or the time. So if you want to confirm anything I'm about to say, you need to go to the literature. But I'm getting a lot of questions about asthma, allergies, and COVID, and how my patients are at more risk for COVID, and what should they do to protect themselves. Honestly, common sense tells us the healthier our bodies are, the more we reduce inflammation in our body, the more we calm our immune system, the more our immune system is better at being there to protect us. Right now, it's still our immune system. You want to eat right, you want to have 10 servings of fruits and vegetables, you want to make sure you have vitamin C, you want to make sure your vitamin D level is really good, not just 30, really more towards 60, because vitamin D is very good for immune function, and most patients with asthma are vitamin D deficient. And people with chronic immune system, even though they feel that they're taking enough vitamin D, their gut is not absorbing it. So you want to make sure that your vitamin D levels are checked and it's adequate. Getting back to asthma, asthma is due to inflammation. The virus, like the flu virus, the virus attaches to receptors in the lung. So if your asthma is not under control, then you're going to have more problems when you get any viral syndrome, and that includes COVID. What's interesting, and I think it's in the Chinese literature, they looked at asthma as a diagnosis alone and proportionately who was in the hospital and who was doing worse. And they found that in one study, asthma was higher, in another study, asthma was lower. And it looks like, and this is where you need to confirm it, but it looks like the typical asthma patients I see with allergic asthma, which involves an inflammatory cell called the eosinophil, they actually did better, probably because of the eosinophil being activated, but they seem to do better and had less problems with COVID. And these are all associations, just like looking at the O positive or O negative blood group being doing better with COVID. It looks like the more severe asthmatics, which are allergy negative, allergy sensitivity negative, not eosinophils, more neutrophilic, more obese, they do worse. And those are the more hard to treat asthmatics. They don't respond as well to steroids. So the more severe asthmatics correspondingly do worse. The same thing with allergies. If your allergies aren't under control, that means you have a lot of inflammation in your nose is all plugged up, you're going to be more at risk for secondary inflammatory problems, sinusitis, triggering your asthma, etc. So what I try to tell patients is, this is the time to get your allergies and asthma under control. The more control you are, the more you improve your threshold to react to any virus, including COVID-19. Take your asthma controller med regularly, because that's going to help you the most during COVID, just like it does during the flu season. Take your allergy meds, particularly your nasal steroids, because what the topical steroids for asthma and allergy do is they help repair the inflammatory response at the cellular level, which shows that it's all detached and the virus can attach to that area. So by improving the barrier in your lungs and in your nasal passages, it protects you from the virus attaching and causing more symptoms. The more you take care of your health, the more you improve your immune function, so it's not fighting the wrong thing and able to defend you against the virus, the better you're going to do.